the intimacy of your own space, and you are becoming lighter and lighter. Notice the lightness around the eyes, and allow your eyes to gently open now. Feel the change within yourself. Before and after, and gently open the eyes. Look around. Turn gently your neck to the left side and observe your space. Something you notice in your room, the color, the texture, the flow of the air. Turn gently neck to the other side and observe your space. And notice something very interesting in your room. And come back to the present moment. Okay. And just if I invite someone, either any change before you were sitting and now, and could you observe the change within yourself? So within 2 or 3 minutes, we can observe the internal change, which is observing in our own being, and that we call it interoception, awareness of our internal being. Okay. Anyone would like to share the experience, the state before and state now, and how it changed, especially the area of comfort and discomfort in the body? Anyone?
हेलो गुड इवनिंग सर.
जब हम पहले बैठे थे और अभी में कुछ चेंज है क्या बॉडी में, especially the area of comfort and discomfort?
So am I audible?
Yeah.
Sir, I have left shoulder pain, and I would say I could actually feel relief of at least 10 to 12% in the pain in my left shoulder.
So this is what is called internal awareness we can develop, and this technique is more of understanding our internal environment, understanding our external environment. So to learn about this, I am just going to present a very interesting case. Okay, so this case I am working almost for 3 years, and the changes are observed recently with a different understanding of this phenomenon. Okay, so let me give a family background. The family is residing in Yavatmal only. The father is working in a blank and he's just going to retire now. One male child of 23-year-old and a female child of 21-year-old. This family disturbed family. Right from beginning, there is a lot of intolerance in the family, a lot of quarrels in the family. And whenever there are quarrels in the family, for a small child, it becomes very intolerable because child doesn't know how to deal with that quarrels, how to deal with that particular environment, and therefore the child want to get safety within, and child doesn't find a safety, and the whole family get disturbed. Everybody is barking on everybody like this here, and there's severe unrest, which is usually at the time of sleep. While sleeping, the child feels very horrible, and child want mother to come to console, but mother is not in a position to console, and everyone is giving a violent episodes in family. So that is the family history. Now this patient came to me about 3 years back, where I was applying patient came with the multiple therapies. He had been to psychotherapies. He had been, but no response. Then what happened? This particular patient came to me, and then we started a simple discussion. But what I clearly understood, by simply giving cognitive therapy is not at all help, because if the person goes in the same environment, the cognition is not going to work, and he is going to be in the same environment. Even if you are giving therapy for 1 day or 2 days, this effect of therapy will be very less, because any person will remain with the therapist only for 1 hour, but he is going to go in the same environment, which is going to almost for 23 hours, and impact is very high. So that child is not able to find the comfort. He was admitted with me multiple times with the different disorders, but he took that, sir, I want to get all right. And then I started him with the body-based therapies, embodied psychology, where we stabilize the person, and whenever the person stabilizes, when a traumatic event they come like volcano. It becomes very intolerable, like this here. And if you want to console, it doesn't become all right. So and whenever the client used to come like this here, just now we had that is the grounding, centering, and orienting. And moment he was oriented, there were a lot of yawning and lot of restlessness which should come. He was just almost shaking. They were trembling in the face like this here, and I can access the fear which is in the face of the child. That was there, and though he was 23-year-old, but one thing was he was just graduated and wanted to do some work, and he had started the what do you say, the vehicle driving institute. Okay, he started the vehicle driving institute. So that was the story. I like this. And then I took the cases. So he was teaching the many persons how to drive, and I was giving an example that uh, the driving is very difficult for the most of people. The chances to get accident are very high, and the greatest fear he was having is that whether I will die in the night, death will come to me. Okay, and there was also suicide episode by the her sister about 2 years back. That also very traumatic event, and he had a great fear. Sir, will I die in the night? Will something happen to me? I'm very scared. Okay, I don't know how to handle this. My parents are not taking care of me, and also I don't know what will happen to me. This was the fear complex which the child was living, perception very high. Okay, this is how the case scenario. So whenever client used to come, I used to take the session, and for settling, I used to require almost for half an hour to 1 hour, because moment child will look like this here, orienting again, lot of say erectation used to come, yawning used to come, and it took almost long term to settle. Then what happened? After almost say 20, 25 to 30 sessions, which I took like this year, then I did my first contact learning process in this clinical hypnosis. And I thought I will start with this also. In the same room, he was sitting here, and I started to apply this breathing awareness. Okay, and when I started breathing awareness, he was again very restless, because moment just I asked, let your eyes be gently closed, and moment he closed eyes, he was just trembling like this here. This was the feeling like this here, and then immediately opened the eyes. Sir, will I die? Okay, just think like. So I invite him to just keep your eyes open and let us see what happens. And the process was done with the eyes open, and again I started progressive muscular relaxation. Okay, it also started, but he was always trembling. He was always restless in the chair. So now this was the scenario, and again it took few sessions. So I stopped. This is not a better thing. Then I tried to combine these both therapies together, like this. So what I did the resource of that, and resource was his driving list, and we had a discussion. See, the name that see, I said, Amit, you are a good driving teacher, and you are making the other to drive, and you are sitting next to the person. So have you gone across with any case that who was having fear? fear of accident. Yes, he said there are many cases. And then what happened here? So do you think that a person who is dying in the bed because something like this here, is it more common, or person dying with accident more common? He said accidents are more common causing death. Have you heard anyone who died just because of anything? No, I didn't. So chances of death in the night is almost negligible. But I feel that. And do you feel any discomfort while driving? No, I don't feel any discomfort while driving. So here, again, I make use of a positive psychology. So what we did here, he was in the same chair, and I started with open eye hypnosis. Okay, open eye hypnosis. The person was with talking to me, and can you tell me any case, any person who was having frightened and you taught him driving? Okay, and when the person started, yes, there was two women who came to me. Okay, and I took like this here, open eye hypnosis like this. Okay, then what happened? Okay, grounding in the chair, feeling safety, and tell me what happened, sir. And whole story. So you started from my institute. Then what happened? Gradually they enter into the my car. I was sitting next to the person. She was having a lot of perspiration. I settled her. Okay. And now here I make a pause. What you are feeling in your body? Are you feeling something? Yes, I am feeling restless. And then we gradually lower down that restlessness by again orienting and reorienting. Then again next, again piecemeal. Again what happened? So then we put the gear, we started driving like this here. Then she was having trembling. I could control it, and whole hypnotic process went till he come to like this. And then during this process, I asked him, "Did you feel the fear? Though the chances of fear was there with your co-partner." No, sir, I didn't feel. Then he said, "How were you dealing?" I was very confident because the clutch and brakes were in my hand. I was very, very confident. And then, so notice the confidence within your body. And is it able to get the same confidence and drive within yourself, feel the confidence? Okay. Then the use of positive experiential psychology in an experimental way, making it anchoring in the body. And that made the change. Of course, this were multiple sessions were taken, combining the grounding, centering, orienting, body-based settlement, and then again going to hypnosis, again coming back. So we never went into continuous flow for longer duration. Because if you go into longer duration, something may come like this here, which is very intolerable for the person. So we came one step, again came back. Again one step, again came back. Like this was a very interesting story. And now to tell you the truth here, that this person is driving very nicely. Okay, he is almost out of the problem like this year, and he's much better. So this is very interesting case and very technique which I want to just share with you. So I'll be just sharing the slides, some of the slides, and just these slides are very different. Can you look at the slides? And we are going to discuss this. This is the same intense fear of survival.
No, we are not seeing your slide.
Okay,
You need to share it.
share the slide, no? Okay.
Screen share, sir.
Share the screen.
Yes.
Are they visible? They are
Yes.
visible?
No. Now visible.
So this is a 28 male Akash, intense fear of survival, intense trembling at night, does not feel safe in the family, hyper aroused with family quarrels. Are the slides moving? No.
No, sir.
No, sir. So you may move to the bottom left corner of your laptop, and there you will find the arrows. They're usually white in color, so
I have this. Needy madam, you have the slides, huh? Can you do it for me?
yes, sir, I'll do that.
Okay.
You will have to stop sharing.
I will stop sharing.
Or Nidhi, as you will start sharing, this will go away. It will ask you.
Okay, Nidhi can start the sharing. Or if sharing not process, okay.
So, just give me 30 seconds.
Ah, okay, till the time. Okay. This is how the fear which is there, which can be seen. Am I audible?
Yes, sir.
This is how you can see a fear which is deeply encoded and where child is feeling unsafe here. Okay, just go further. Family history, mothers have depression, sisters have OCD, and is all fear induced. And families in a social isolation. I just explained what happened when breathing awareness was started, when PMR was given. And just look at this product picture now. There are two very interesting pictures. This is animal which is touching the toy. Toy is not notorious, but it may transfer the fear to all the animals, and animals started running. Just look at this. And how this is a child who is moment sees something, sees the fear. Let's go further. If you look at the face of these children, see what happens immediately. And how it affects whole body. Next, please. Next slide. And now this is the very important part to learn now. See, if you have seen all the faces, what was the observation? Whenever a fear is experienced from childhood, this is the greatest traumatic event which happens. Now, when child is born, the only organ which is developed is amygdala. And amygdala is having three important parts: medial, central, and lateral. Medial part of amygdala is directed to a central core where all the fear, everything is deposited. Lateral is connected with neocortex, and central part is connected to above and downwards. So, for a small child, only organ or only brain structure which is more mature is amygdala, and that is going to feel the safety. If the safety is felt with the mother, the growth of child will occur good. But if safety is not felt with the mother, the child gets intense fear, and either child develop attachment disorder, which is called anxious attachment disorder, or it can produce dissociative attachment disorders or disorganized attachment disorders, which happens because of this amygdala, because child doesn't find it safety. Now, when child becomes 2.5 years old, then another organ we develop, we call hippocampus. And hippocampus is the area which is going to come, which is going to experience fear and make the child out of fear. The very interesting organ we call it insula. You can see in the slide. And insula is a organ which is there. You can see here. This insula is present just beneath the inferior frontal gyrus, just below the Broca's area. There are short gyra and long gyra, and this insula is going to get a clear view of our inner environment. Okay, so we have two things. One is neocortex and one is subcortex. And insula is it looks inside. And what is more important? If survival is more important, the insula is going to give information survival, and this happens in all children which we have seen now. So if child is feeling restless fear, impossible for study or impulsive, and that severe fear is. Can we go further? So there are two important circuits from amygdala. Just please go further. Nucleus ceruleus is again a small area in the brainstem, is going to receive the impulses from the amygdala. Okay, so we have two important circuits from amygdala to hippocampus to limbic area to the thalamus and to neocortex. Okay, this is working exploratory brain, where you want to learn anything, understand anything, feel safe. But if child is not feeling safe, which is happening in that particular child, though he was 23 or 25-year-old, then what is happening? The amygdala was operating. From amygdala, the impulse was coming to nucleus ceruleus. And from nucleus ceruleus, there is autonomic activation. The sympathetic as well as the dorsal vagal nerve was getting activated, and that's because severe constriction in the chest, severe constriction bronchioles, severe tightening of muscles, and there was a hypoxia in the body that caused the sensations of discomfort, and that caused that whether I will die. So that was the understanding. Please further. Next slide, please. And this is what we call autonomic dysregulation. So most of the fear cases are the autonomic dysregulations that persist the body throughout, and any sensation which comes is going to trigger it, and the person get triggered. So therefore, initial exercise, what I made that understand what is happening within you at the moment. The regulation and dysregulation. So fear, anxiety, phobias, even all these are autonomic dysregulations, and it is attempt to survive in the environment. Can we go further? So this is a classical fear response. You can see at the eye, and to be very specific, this is stored in the subcortical areas in the body. So to be more specific, we have neocortical areas and subcortical areas. So instead of making it conscious subconscious mind, let us make neocortical and subcortical, and all the fears are engrossed in the form of sensation in the body. And when child is not feeling well, it expresses as the abnormal sensation. What we understand, what we feel now, there is suffocation, there is chest pain, there is breathing, inability to breathe. Okay, this is because of the autonomic dysregulation felt at the subcortical region. It is attempt to survive in the difficult environment. Can we go further? Further slide, please. Okay, so I will stop the sharing. Can we stop the sharing and come into the? Or just let's take the slide. But this is what we are going to learn. This new technique, which is a combination of orienting reflex and exploratory reflex and survival response. So we are going to make a connection of this. Okay. So now let us understand this important. What is exploratory response and what is the defensive response? Now we are sitting in front of us. Am I audible now? Yes.
Yes, sir. Yes, sir. We can hear you.
So exploratory response means you are studying, you are concentrating, you are teaching, you are carrying your work, This we call the exploration response. When there is difficulty in the environment where you don't feel safe, then you go into defensive response. So this is called a orienting response. What is orientation? Orientation means you are looking around, scanning the environment, whether it is safe or unsafe. If it is safe, you move. Just you are going to a picnic, you enjoy. This is classical safe expert response, which is judged by neocortex. But moment you don't feel safe, what happens? अगर हमको safety feel नहीं होती, then there is a startle response. You become starter, you become arrest, and you immediately enter into defensive response. What is defensive response? Number one is the fight response. If the target is very minimal, just like this here, fighting response will, and we try to overcome it. I will not release. Suppose a child can fight with child of same age. But if you cannot fight with the bigger person like father, there is severe anger, but you can't fight with the father. What will happen? When you can't fight with the father, you have only option to take the fight energy in the body and stay that fight in the body. That is the only option. You can't go. So this is how the stagnated fight response body, which is called the defensive orienting reflex. Suppose there is another incident family where mother is after the child has done something, and child is trying to run, and mother catch the child and just is ready to hit. Now child want to run, but child can't run. What will happen? Again, the flight energy is being stored in the body, and that is continuous neurocircuits are on, and you don't feel good. And therefore, you find in most of children in classroom, they are very restless, they are anxious. This is nothing but the stagnated flight energy. Some are very angry, some are very violent. This is nothing but the stagnated fight energy. And the third response is the freeze, where the person can't go. This is again animal response which is there. Okay, when person cannot fight, person cannot play, the only option the person has, play dead. Just shrunk everything and play dead. Again, there are two things: either huge energy stored in the body, and person mimic it like this, which is a high dorsal state. Okay, where there is severe atomic dysregulation, and second is just giving up. Okay, this happens in depression. Depression, you just give up. Hypothyroid, give up like this here. So therefore, person doesn't want to explore. And this is how a stagnant state manifests in even from childhood to adulthood. This is what we call the adverse childhood effects, which are AC study, which is being designed on these backgrounds. So in this case, what you observe, the child or any person remain to defensive state for a prolonged state, and child doesn't come out. And whenever you want to hypnotize the person, in our routine, we may be hypnotizing. Of course, we start very gradually. But moment a traumatic area comes, the person will be very dysregulated. Person doesn't know how to, and even that abnormal behavior may come like this here, and we also may not be able to handle this. Okay, or we may not get a complete relief. So, what is interesting, important part, the person has to go into that whole area, release that, expand the tolerance, and discharge that energy. If this is done, I remember, sir, there is a very interesting story sir has told in one of presentation. There was a small child who was having severe anger in the about the teacher, and the teachers he wanted to murder teacher, and you said just murder it, and you this is how the traumatic energy released by the child, like this here, and child feel better. Most of us have traumatic energy stored in the body as a persistent activated neurocircuits in the lower brain, especially the subcortical areas. And they project the information to the neocortex, and that causes the person restless. And this is the basic reason why children do not perform good in the classes. Yes, if you are aware of this particular whole story, then how this technique is going to work. Any question up till now? Any question? Anybody can ask this question, because it's a very interesting thing which is coming. Okay, so next point is that any child, it is essential to find a resource. What is resource? Resource is a person or a place or an event or anything where child feels safe. Okay, this may be external resource, maybe mother, father, anything, or it may be even teddy bear, or internal resource where child feels good with himself. So in that case, what we have used, we use the resource of driving. Okay, we use the resource of driving, and we have hypnotized the process as driving process, which child feel confident. And even it was not it was not a hypnosis. It was just going say here and say and just track the case and settle again. Means you are triggering, you are settling, you are triggering, you are settling, and so that person can become in very light state. Yes, I can manage this. I can manage this. I can manage this. Person get confidence, and the view about the disorder start changing. Okay, so is it clear? Got the point here? So in this new technique, what we are doing? Anyone to ask any question? Could you understand what is neocortex, prefrontal cortex? So let us understand any thought which comes into the brain. Our brain judge the threat value. If there is no threat value, it is going to come thalamus, from thalamus to prefrontal cortex, prefrontal neocortex, and to all areas we take the action. But if thought is triggering, it may be anything. Okay, it is going to go thalamus. From thalamus, it is going to go where limbic area, especially hippocampus and mammary bodies, antephonics, posterior phonics, and then it's going to track to the amygdala, where what you can say the sensing of the threat value is judged. And if threat value is there, and if person feels that is threatening, then nucleus coeruleus is activated, autonomic nervous system is activated, and depending on two stages, either sympathetic system or dorsal vagal system. Sympathetic system is taking a fight and flight, and dorsal vagal means freeze. High dorsal, low dorsal. High dorsal means huge energy stored in the body, person cannot express, and low dorsal means submitting. This is how the body responds at the internal level. And this persists for longer duration, that create a behavior response in the person. So to be very specific, we are involving this whole process in the body as a persistent neurocircuits. And if at all there is any sense of survival, neocortex shut off and your cerebral brains get activated, and your whole process starts in the body as a survival. So it migraine may be a survival response or fight response, or even blood pressure may be again a persistent response of survival. Okay, so these are the 4 stages which you can understand. Now, so if you're well aware of this particular whole process, how this technique is going to help. So there are 2 important things. So which you have to practice with me. Are you ready to practice with me? There is very interesting technique I am going to show you. Okay, आपको सब देख, first observe, pin me and observe the technique which I do. First, I'm going to induce the hypnosis shortly without saying anything. Then I'll explain how it is being done. Then I will make you to do it. Okay, this is how short induction without saying anything. And then we're going to come out into this exploring response. Again, we deepen it, again coming it like this here, so that the discomfort become more tolerable. Are you understanding? Are you getting, sir? Barabar hai ye? Palan sir? Yes.
Yes. Go ahead.
So now I am going to show the case. Pin me and just observe what I am doing. Then I will explain it. अच्छे से मुझे देखो. First, what I am doing, I am settling myself in the chair. I am taking almost 30 seconds to 1 minute. I'm then gradually opening my eyes. Very slowly, just observe. I'm open, the way I'm opening. Again, I will be doing for again closer observation. Look at my eyes, the way I'm opening. I'm not looking anywhere, but I am taking myself into trance immediately, instantly. Observe flickering of the eyes. Eyelids are touching each other. The relaxation in the eyelids is slowly transferred to the whole body. I'm gently opening my eyes. Look at my eyes. You can feel as if I am coming out of the trance. So what I am doing, I am slowly, first my eyelids are closed. I mean, slowly giving suggestions, and you can notice the flickering, just like Barnett technique, but you are just doing it very slowly, very gently, without looking anywhere, and you can notice the flickering, and then it's gradually coming. You can even give counts 1, 2, 3, and it's just touching, and the relaxing eyelids is gradually being transferred into the whole body, and you are feeling what you are feeling. You are scanning your body for comfort and discomfort, where you are feeling. And now you visit the area of discomfort. Anything. Okay, we call it the subjective units of discomfort. Any discomfort. And moment you visit the discomfort, feel the discomfort in the body. At times this may be triggering also. And then you apply the second part of this. Now here what you are doing, you are feeling the chair. Your hands are on the laps. Your feet are grounded. And you're looking the sense in the body. And if you're feeling the discomfort, where are you feeling? Suppose there is quarrel in the family. Leave the quarrel. What do you feel? Feeling discomfort in the chest, tightness in the chest, dryness in the mouth, tachypnea. Now, this discomfort may be tolerable or intolerable. If it's tolerable, okay. If it's intolerable, put your hand on the chest. Feel it. Feel the support of the hand. Feel the supporting person. Take the resource. And if too much, then again gently open the eyes. See now how I am opening. I am opening present moment. Come into presence. This is orienting reflex. I am looking in the room, slowly observing the colors, feeling the air. Again coming, looking around. The intent look around is to make the present. You come into present. Okay. And you are coming out of discomfort, you settle yourself. Again, you can go into the trance. Again, revisit the area. Again, you can come. So that discomfort become more tolerable. And person can deal the process with a proper meaning. Okay, and this is the way you can go deeper, come to surface, go deeper and come to surface, and then discomfort which is stored in body become more tolerable. If it's too much unmanageable, then you can take the resource. Resource, maybe mother can, you are having mother with you, or parent figure with you, or you have this resource for driving. You are like this here. You can change it like this. So the intention is the discomfort which are stored in the body is to come to surface, make it more tolerable, discharge from body, and think newer way to deal with the same problem. This is how healing happens, and we can use hypnosis in a very interesting way in this gradual going up, going down, instead of going into the deeper state like that. Okay, so this is the technique which. Okay, Palan sir, your comment please.
Okay. So you finished? It is complete.
I have to only experiment. अब सबसे करवा लेने का है टेक्निक, प्रैक्टिस, लेकिन डिस्कशन.
But time is getting over. So either we have discussion or you, because it is 9:30 now.
Okay.
Time is 1 hour. So if anybody has got any question or any comment, you describe the whole technique, isn't it? Basically, it is not going into the deeper trance, but slowly, imparting training to the client to go in a little deeper. And if there is discomfort, coming into the waking state. That is what basically you are trying to tell, isn't it?
Yes.
Okay. If there are any comments or any question.
There is a question in chat box. May I read it out?
Yeah.
Yeah. There is a question from Ishita Sodhi. Is there any particular strategy to get rid of the stagnated energy? The energy that you were explaining, fright and freeze, which gets stored in body.
It is strategy means this is a very slow work, because they're just like onion. If you peel one layer of onion, there will be deeper layer, again deeper layer, again deeper layer. So outer there will be anger, but inner anger, just under the anger there will be sadness. Under sadness is loneliness. During each session, we explore this and take the patient out of that, so that person can introduce new aspects of life in the life of the person. With how we have to go by layer, because in the deeper childhood experiences, they are ingrained in the mind of a child right from childhood, and most of our problems, they start from childhood, which we are not aware also. So as you go deep, just go one layer and become tolerant. Okay, develop capacity to deal with that. Again, go next session, go again deeper. The advantage of this is that the person remains with him or her 24 hours. Person can take into trance, and person again can take into oriented, person can be back. And this become a daily practice, and the incidents become more tolerable. That is the advantage.
Anybody else has got any comment? Or yes, Renu madam, you want to say something? Please.
So being a student of psychology, I see this method more near to systematic desensitization. That's the behavioral modification technique, one of the techniques of behavioral school. That is systematic desensitization. So as you are saying, one by one, we are peeling off the skin of the onion and then moving. And as soon as like the person starts feeling intolerance or fear, or then more or less we stop that session there itself. But if the person gets comes to a normal conscious level rather than in trance, and then again the person goes slowly to the deep and deeper stages of one's complexes or one's problems or issues. So, as I said, I just again repeat that it resembles, but the presentation was really excellent. The way you have related it with the brain functions, that the different centers of the brain and things. So that was a real kind of learning for me, because as I said, I from psychology department, psychology field. So it was a good presentation. Thank you, sir.
The only thing which I am to add is that here we are giving the skill to the person. That person can go within and person can bring links here. So he learn automatically layer by layer to go within. And
Yeah.
the person may not require therapies every time.
Yes.
That is
Yes.
the advantage of this technique.
That is the part of the hypnosis we can say. So that the systematic desensitization from the behavioral modification techniques and then hypnosis. So it's a combination of these two.
Orienting reflex. Orienting reflex is most important. You orient to present moment and you can immediately bring to the present moment.
Yeah.
That is the best part of it.
Yeah. Thank you.
Thank you.
Sonam, you have any question?
Yes, sir. Good
So-
evening, sir. Good evening.
Good evening, please. Please.
Sir, excellent. I was feeling so nice when I saw this, and Barnett's technique, Palan sir ko bhi, I've told that I really like that technique. I could sense it. वैसा कुछ मुझे इसमें feel हो रहा था. Sir, I wanted to know, some clients they put the hand on this heart, अधिकतर heart healing के लिए हार्ट पे ही हाथ रखते हैं, या अधिकतर ऐसा ही देखा है, बट उनमें एक रेजिस्टेंस होता है. बोले मैम वो जा नहीं रहा है, बॉडी कीप्स द स्कोर. तो उनको ध्यान रहता है कि मेरा इमोशनल पेन ने यहाँ पे जगह बनाई है. तो कई बार वो ये बोलते हैं कि मैम जा नहीं रहे हैं, एंड उनको अलाउ करने को बोलते हैं, ओके लेट इट गो. सर, इन दिस सिनेरियो व्हाट वुड बी योर सजेशन कि ऐसे में हम क्या कह सकते हैं सर उनको, क्योंकि I'm really keen to learn from you, sir. Yeah.
So here what we do, whenever you put a hand here and feel that, then you expand that sensation because there is constriction in the chest area. Feel this. Then you expand either moving by the hand or with the breathing, and where it is stagnant one particular area, you can feel expand all the body here, and then it start discharging from the feet. So therefore, I invited you to feel the feet and how it is discharged by yawning, by sweating, by trembling, by shivering. This is the way of body to discharge that stuck up emotions inside. So either you expand, which is called as affect tolerance, expansive affect tolerance, or discharging emotion through the sweating or body movements. There's some body movements also. There may be eructations also. There may be cough also. These are body ways to release those emotions. There are somatic ways.
Yeah, great, sir. Yeah. Thank you.
Very nice. Anybody else has any comment, question? Dr. Dayal, Dr. Santanam, I invite you for any comment. Dr. Dayal, please.
I think it's a lovely presentation.
Okay.
And also the technique is very useful. It's taught as something that will make the person independent between sessions. I really appreciate your presentation, Dr. Sanjay.
Right.
Thank you.
Thank you, sir. Thank you.
Dr. Sanjay sir, it is a very laudable presentation.
Thank
The new techniques, what you taught, everybody would have enjoyed this technique. I take this opportunity to congratulate you, sir.
Thank you. Thank you, sir. So humble. Thank you, sir.
So with that, Nidhi, shall we close the meeting?